Hi, we're students from Parkland Dental Hygiene program, and we're going to be talking about the oral manifestations of HIV/AIDS.
The human immunodeficiency virus, HIV, is a lentivirus, a subgroup of retrovirus that causes HIV infection and over time acquired immunodeficiency syndrome, AIDS. AIDS is a condition in humans in which progressive failure of the immune system allows life-threatening, opportunistic infections and cancers to thrive. Without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. HIV can affect anyone regardless of sexual orientation, race, ethnicity, gender, or age. However, certain groups are at high risk for HIV and merit special consideration because of particular risk factors. Some groups of people in the United States are more likely to get HIV than others because of many factors, including the status of their sex partners, their risk behaviors, and where they live. The turnover time of oral mucosa is much faster than the turnover time for skin and other tissues of the body. Because of this, disease manifestations are often first seen in the mouth. It is important for healthcare professionals to know how to recognize and identify the many oral manifestations of HIV. Our objectives are for health professionals to become familiar with and be able to recognize the many oral manifestations of HIV, and for health professionals to learn how to confidently perform a practical and thorough oral examination on patients. Oral candidiasis is the most common HIV-associated oral lesion. It can be pseudomembranous candidiasis, erythematous or atrophic candidiasis, hyperplastic candidiasis, or angular cheilitis. Usually topical applications of nystatin or clotrimazole are used to treat Candida infections. Immunocompromised clients often require systemic treatment. Pseudomembranous candidiasis. It appears as creamy, white, curd-like plaques on the buccal mucosa, tongue, and other oral mucosal surfaces. It can be wiped away, typically leaving a red or bleeding underlying surface. In patients, it causes a burning metallic taste. Erythematous candidiasis. The most underdiagnosed and misdiagnosed oral manifestation of HIV disease. The condition is presented as a red, flat, subtle lesion on the top side of the tongue or on the hard and soft palate. It can be very painful for the patient. Hyperplastic candidiasis. This appears as a white lesion that does not wipe off the mucosa. Other names for this are Candida leukoplakia and hypertrophic candidiasis. An important diagnostic feature of this type of candidiasis is the response to antifungal medications. If it doesn't respond to antifungal therapy, a biopsy should be considered to establish the diagnosis of the lesion. Angular cheilitis. This presents as erythema or fissuring of the corners of the mouth. This can happen when saliva is collected at the corners of the mouth. This also frequently accompanies intraoral candidiasis. Hairy leukoplakia. This is a collection of thick asymptomatic white lesions, usually seen on the sides of the tongue. They can be unilateral or bilateral. The lesions can't be wiped away. This is caused by Epstein-Barr virus. The prevalence of this lesion is approximately 20% among HIV-infected persons and up to 80% among those with AIDS. Kaposi sarcoma. This is a malignant, slow-growing endothelial cell neoplasm that is seen in some people with AIDS. It may be present as small, innocuous-looking, flat, reddish, bluish, purplish, or brown lesions of varying sizes, including large nodular lesions. This lesion often appears on the gums associated with the teeth. Diagnosis is frequently missed in African American patients due to lesion coloration. Oral warts. They can occur in any individual regardless of HIV status. Recurrence after treatment is uncommon except in the case of HIV individuals. The warts may be cauliflower-like, spiked, or raised with a flat surface. Necrotizing ulcerative gingivitis. This is a marker of severe immune suppression. It is a bacterial infection of the gums that is characterized by inflammation, bleeding, pain, fever, and halitosis. The treatment for this would be cleaning and debriding the areas with cotton or gauze soaked in hydrogen peroxide and a topical anesthetic agent daily or every other day for about 1 week. Also, twice daily rinses for 20 seconds with chlorhexidine.
Now we will demonstrate an oral examination. For this examination, you will need gloves, mask, protective eye gear, a mirror, gauze, and an adequate light source. You will begin by politely asking your patient to open her mouth, skim the inside of her cheeks, go ahead and pull out her outer lip, make sure there are no lesions. If anything looks suspicious, make sure you document it. Next, you will take your mirror and examine the palate, the upper palate of your patient's mouth. Next, you will ask your patient to stick out her tongue. Go ahead and move the tongue left and right, checking for lesions as well. Next, you will ask your patient to stick her tongue to the roof of her mouth and check for lesions below the tongue as well. Lastly, ask your patient to open her mouth, depress her tongue, and examine the tonsils. And that is how you complete an oral examination.
Conclusion: HIV compromises the immune system and allows opportunistic infections to take hold in the body. Manifestations of HIV often first appear in the oral cavity because of the high turnover rate of oral tissues. It is important for healthcare professionals to be able to properly perform an oral examination and recognize the manifestations that are associated with HIV.
Thank you for watching. I hope this video was informational and helpful.